Hello, my name is Rimawan Pradiptyo, and I'm the head of the Department of Economics, Faculty of Economic and Business, Universitas Gadjah Mada. Today, I would like to introduce social capital, or the movement. It's called SONJO. SONJO is abbreviation of Sambatan Jogja, and we were formed on 24th of March 2020, and to the moment, we already have 2,000 members and distributed among 24 WhatsApp groups. So, back again to the question about the role of the social capital. The role of social capital during the pandemic or during the natural disaster is usually quite a lot. We can see from time to time in Indonesia, because we are prone to the natural disaster, we used to have the social capital. Now, how the role of the social capital into the economic growth, for instance? We can see it from the literature that the social capital will facilitate the innovation and reduce the social capital, also reducing the transaction costs. But now, what we're trying to ask is that, will it be possible for us to use the social capital to innovate during the pandemic in order to minimize the impact of the pandemic? So, everything is based on the fact that how we perceive things. Now, during the COVID-19, the way we've seen it is probably different to the others. We may see the COVID-19 as a disaster or non-natural disaster, but the way we see, from SONJO perspective, we see it as a war. And we can see it as a common enemy. So, what is the common enemy? The common enemy basically working as though like the public goods, which is non-rival and non-excludable. So everybody will get the impact. Now the question is that how we can fight against the common enemy. So we have to work together. But then another question is that until when we have to fight? We don't know as yet, because we don't know how long the COVID will last. So in these circumstances, we're trying to play as though we play the infinitely repeated games. Okay. Now, what are the dominant strategy for this? There are three dominant strategies for this. First is the expect the unexpected. This is in terms of the impact of the pandemic. Secondly, we talk about the thinking innovatively in terms of the solution. And the most importantly is the third one, which is how to mobilize the resources. Now, this is the picture on the left-hand side. It's actually the poster which was very familiar, very popular in Indonesia. Everybody said that, oh, we are all in the same storm, but we are not in the same boat. But the way I've seen is that if we were framed by this kind of poster, then of course we will work individually. Then I'm thinking about, hang on, in Indonesia or in Java, we have what I call SONJO. The SONJO is communal work that has been done traditionally, and I believe that in other part of the world and also other part of Indonesia, we do have a communal work, a similar communal work as well. Now, what is the benefit that we have at the moment is that we are all linked by internet. So I'm just thinking is that, will it be possible to do the communal work, but we use the internet as the basis for working collaboratively? So how to mobilize the resources? This is another question. During a war, economic crisis or the pandemic, resources mobilization, of course this is a paramount. In developed countries, probably people can rely on the government to support everything. But for us, in developing countries, like in Indonesia, of course we cannot expect that our government will cover everything. In terms of the financially, of course we don't have a similar situation as if that in developed countries, for instance. So in these circumstances, we're trying to think of how to revive the concept of Sambatan, which is Sambatan is the traditional form of communal work that we have in Java. So SONJO or Sambatan Jogja is using the similar approach by using WhatsApp group as the mean of the synergy. So what is the focus of SONJO is we're trying to help vulnerable people and people at risk, and we're trying to minimize the adverse impact of the COVID-19. And what about the value of the SONJO? Indeed, that we are an informal institution, but we still need to have a value, or we need to still to have the vision or the mission of the organization. So basically, we promote 4 values in here. First is the integrity, transparency, empathy, and synergy. Now, this is the distribution of 24 WhatsApp group of SONJO. So 20 WhatsApp group is basically for the internal SONJO, and 4 WhatsApp group we use it for the collaborative work with other communities in Indonesia. So if you can see, what is the link between the situation in the COVID and the SONJO activity. So we can see it as follows. So we have, in Indonesia, basically, we have 2 waves, December 2020 until January 2021. And then the second wave, it was in July and August 2021. And then you can see all sorts of, how the SONJO works in the circumstances during that time period. And in May, we already prepared for the second wave at that time. That was when in India, they have a surge in patients. So, how we describe SONJO? Back again to the role of the social capital. We're trying to reduce transaction costs by providing public goods for society. So we have our coverage is in the sector of health, economy, and education. Everything is free. And most importantly is that we do not finance by any other institution. So basically, we just use it, for non-financial resources. So, how the WhatsApp group can solve the problem? Okay, so imagine if you trying to gather 50 people in a WhatsApp group. So everybody will have, at the same time, is that they have a demand to solve their problem, but at the same time, actually, they also has a supply to solve other members' problem. So what you need to do, of course, at the first time, in the first place, people will telling about all kind of problem that they have. So in these circumstances, you're trying to record everything, so you can see the demand. But then, later on, people will start to say, hey, hang on, actually I can help this thing, I can do that, I can do that. So in these circumstances, that one individual has 2 things. One is the demand to solve his or her problem, but at the same time, they have a supply to solve other members' problem. So in these circumstances, we have the demand and supply to help each other. And then we can solve the problem so easily. Now, the question is that, given the fact that we don't have financial resources, so how to run this movement? So the movement, the capital of the movement is basically only one thing, which is trust. So trust is paramount. And how to build the trust is only 2 things. First is we promote the integrity, and secondly, we promote the transparency to all of the program in SONJO. So the question is that, another question that you may ask is that, what about, and how we can develop a program, for instance? Okay, we start from the discussion. We start from identifying the problem. Where the problem is emerged is actually the discussion within the WhatsApp group. So imagine that in the early days of the SONJO, we only have one WhatsApp group. And then people start talking about the problem that they have, and then they start talking about some solution that they're trying to offer. And then we can say, why don't we discuss this in a webinar? That's why we have the webinar, weekly webinar I call Sanjo Angkringan. Yeah? And at the moment, we already have episode of 60. So during that period, in Sanjo Angkringan, people will discuss about how to solve the problem. Okay? And then if we agree, we have we created a program, and during the program we can have a pilot project, and if necessary, if we need a training and everything, so we have another program. It's called SONJO Mikunani. So SONJO Mikunani is basically a media for sharing knowledge among the members of SONJO. And up until now, we already have episode 9. And then lastly, we talk about how to mainstream the program. We use the synergy. So in these circumstances, we work together with the other CSO. We may work with other universities, and also we may work with local or central government. So this is the way we're trying to develop a program. So how many programs do we have? Well, this is our program. In economy, we have 7 programs. I do not want to explain it because Dr. Gumilang Aryo Sahadewo will explain about this program in more detail. And these are the program for health, and we already have 13 programs for health. Again, I will not explain everything. I just want to show to you some of the program works and how to link among the programs. Okay, now I would like to explain about the first program in here. That's we call SONJO Rival. So what is this program? This program is to help hospitals in Yogyakarta to refer COVID-19 patients among them. It should be noticed that not all of the hospital has the facilities for taking care of the COVID-19 patient. Even though the government already have the referral system software, but the referral system software that the government has is not practical, and it was built long before the COVID-19. And during the COVID-19, it's basically many GP or many doctor and also hospital has a difficulty in dealing with that software. So they asked us to help them. And then we create the WhatsApp group. It's called SONJO Rewangan, and all of the director of the hospital join in there. And then afterward, we offer to use the system, which is very simple, which is what I call the double auction. And the second one, from the double auction, we trying to put it in an Excel, and then we discuss it in the WhatsApp group. So basically, a hospital who would like to refer a patient, they just ask, okay, I would like to refer this patient. We put it in the Excel in there, and then afterward, we're trying to show it to everybody in the WhatsApp group, and then they start talking each other, and then they say, okay, just send it to my hospital, for instance, and then this is the way it's worked, okay? So, how many patients have undergone this? So this one, we created this system since December 2020, and up till now, we have 150 patients who underwent the system. And remember again that during December and January, that was the first wave of the COVID-19 in Indonesia. The second program that we promote here is what I call the shelter. So it is imperative during the pandemic is to separate between healthy people and people who are infected with the COVID. Now, we promote this program, and this program is, the shelter is actually, has been developed by Health Office of Bantul Municipal. They created 2 systems. The first is multi-shelter system, and second one is the dual referral system. So we have the sub-village shelter, and in Indonesia, people who take the PCR test may need to wait 1 until 3 days. The question is that during waiting, where you don't know how they go, they may go anywhere. That's why we're trying to put them in a sub-village shelter. And then we also create, they create the village shelter. This is to accommodate the asymptomatic patient. And then they have the Regency shelter. This is for patient with light symptom. If the condition is worse, then the patient will be referred to the hospital. But in the hospital, if your condition is getting better, then you will be referred back to the shelter. So using this way, they can maintain that the only patient with medium symptom and above are in hospital. So this is a wonderful idea from the head office of Bantul, and we support to promote them across many areas. So at first, the original form of shelter is just only 3, and then we're trying to extend it to many forms. The first form that we're trying to promote as well is what I call shelter in pesantren. So pesantren is Islamic boarding school, and there are plenty in Indonesia and scattered around, something like that. Then we're trying to promote that every pesantren build their own shelter. Secondly, we're trying to promote as well in the university. And you can see the data in there, how many university has developed this, and we're trying to promote that, to promote the shelter, and also to the company. So we work together with, collaboratively with 2 companies. It's one in West Java and the other one in Jakarta. On top of that, we also develop the IT system. Is called Sitangguh, and Sitangguh is basically we're trying to map the existence of the shelters. So this is the situation that we have. You can see this is the map of Java, the area of Java probably as big as England, and we have 5 areas that we work collaboratively with the people over there. So the first one is in Madura, and also Madura in East Java, and also the Kudus, Pati and Jepara, they are in Central Java, and also Jakarta and Bogor, that is in the West Java. And we also offer technical assistance, and we have in the SONJO Migunani, we have a webinar, and then we invite 2 speakers here, the expert, Dr. Glory and also Dr. Sri Aminah, to explain about the concept of shelter and trying to facilitate, how to develop the shelter. And afterward, usually we develop a joint WhatsApp group with them. Okay, so this is the joint WhatsApp group that we developed with 4 communities. And on top of that, we also work collaboratively with the Faculty of Medicine of UGM and also their alumni in order to create, we call it as a life doctor. So this is a consultancy, online consultancy basically, because at that time, we developed this in July when we have in a second wave. So this will help people who undergo the self-isolation or patient under the isolation in the shelter, for instance. It's worked perfectly, and the inquiry was about 3,000 inquiry every month. So now, we also have the Sanjo Saras. So what is the Sanjo Saras? The Sanjo Saras is the quality assurance of the shelter. We already have a shelter, we're trying to promote shelter, but at the same time, we have another team, the volunteer team, especially the volunteer team from the Faculty of Medicine of UGM, and then they work collaboratively with the Faculty of Pharmacy in order to ensure the quality of the shelter. Because we know the shelter is basically situated in a village, and we have to make sure that their quality is up to the standard. Now, at the moment, the number of a patient declined sharply in Indonesia. That's why we're trying to reallocate the volunteers of this movement to the vaccination, the mass vaccination. Now, we have Sanjo Husada Tangguh. So what is this program? So this program aims to support the existence of shelter and for covering the operating costs for the mass vaccination. So we work collaboratively with other CSO, and we're trying to facilitate the donation to the shelter, to the volunteers group, also to the hospital, and also to the patient who do the self-isolation. Now, during the second wave in July, all of a sudden we have a problem of the coffin. We have a lack of coffin, there was scarcity of the coffin and also the body bag. And some of the members of Sanjo and then send me WhatsApp and saying that we would like to produce the coffin, and this one is for free. So this is the wonderful thing that we find in Sonjo. And you can see there are three organization or movement that provide the body bag and also the coffin for free. And that's 100 of them, that they managed to produce 100 of them. Now, another problem that we have during the COVID-19 is about the corpse handling. Now, it will not be a problem if the patient died in a hospital, because the hospital will take care of the corpse appropriately. The problem emerges if the patient died at home. So that will be difficult, because you may not be able to send it to hospital because the hospital may be full as well. So what we need to do is we're trying to offer the training on how to taking care of the corpse, especially the infectious corpse. So not only you have to conform with the health protocol, but also you have to conform with religious requirement as well. So this is the training that we have since January, and we do it to all of the community. Lastly, we have Sonjo Tetukau. Sonjo Tetukau is mass vaccination that we currently do extensively in Yogyakarta. And the way we're trying to do this, it depending on the situation of the people. So it depends on the local needs, basically. So how do we do this? We work collaboratively, first with the army or police and also the health office in order to obtain the vaccine. Secondly, we work collaboratively with various NGOs in order to cover the operating costs and also the managing the event. Because imagine, at one point we have 1,000 or 2,000 people that have a vaccination start from 8 o'clock in the morning until 1 o'clock in the afternoon. So you need to have some kind of a managing the event in order to minimize the crowd, for instance. The third one is that we work collaboratively with the Faculty of Medicine and also the pharmacies in Yogyakarta in order to, because they provide the medical staff for the vaccination. Now, as we discussed before, this is the type of the vaccination which adapt to the local needs. On the left-hand side, you can see that the vaccination has been done in the evening. And why we do that? Because this is a particular in the area of Gunung Kidul. And in Gunung Kidul, many of them, they are laborers, they work in other cities, and they will return back home in the night or in the evening. So if you're trying to run the vaccination in the day, you may you may deliver 500 invitation. Probably you will be very lucky if you have 100 people attend to the vaccination. But when we're trying to do in the evening, like our colleague from Loro Bologna, and then what they have, 1,000 of them will come. So this is the situation that's typical in Jogja. So in other areas, like for instance, like Bantul, their community works is very well. So that's why we're trying to develop the mass vaccination using as much as possible the community works. So lastly, what can we learn from this? We learn about how to tackle the problem by ourselves. Prior to the COVID-19, probably we always thinking about business as usual. But nowadays, during the pandemic, we cannot work as though that's a business as usual. No, we need to promote what I call the eagerness. We call it in Indonesian, it's called MAU, M-A-U. This is means of eagerness or the willingness. Willingness to what? Willingness to think, willingness to adapt, willingness to innovate, and willingness to help each other. Like the Quran said, indeed, Allah will not change the condition of a people until the change until they change what is in themselves. So this is the problem that we have. A pandemic is our problem. We have to work side by side. We have to work collaboratively in order to minimize the impact, the adverse impact of the pandemic. Thank you very much for your attention, and we do hope we can learn from what we've done in Yogyakarta. Thank you.
Greetings, colleagues and students. My name is Gumilang Aryo Sahadewo. I'm an assistant professor at the Department of Economics, Universitas Gadjah Mada. On behalf of Universitas Gadjah Mada and the SONJO community, I will present community-based initiative to mitigate the COVID-19 impact on micro and small enterprises in Indonesia. Thank you so much for Global Business School Network Humlock Challenge for this opportunity. The impact of COVID-19 on micro and small enterprises are quite significant, particularly during the COVID-19 pandemic. Before the COVID-19 pandemic, we can see that the economy is buzzing, people are buying goods and services, and the economies are investing. However, during and perhaps in the few years after the pandemic, the situation is not going to be as well as the situation before. There are going to be challenges faced by the micro and small enterprises to deal and adopt with the COVID-19 pandemic. So the impact has been significant. Statistics Indonesia recorded that 80% experienced drop in revenue, and 8 out of 10 micro and small enterprises experienced lower demand from consumers and clients. And 6 out of 10 micro and small enterprises face financial difficulty. And they also face other significant challenges. For example, it's quite difficult and it's quite challenging for them to get the inputs and intermediary goods for their goods and services. And there are also other challenges, for example, in going digital to adapt to the needs of the COVID-19 pandemic. So in the early stages of the pandemic and in subsequent waves, lockdowns are inevitable. So the question is, what are the strategies to reach out to consumer given limited mobility, but at the same time we can keep the economy rolling? And what are the strategies to improve the livelihood of micro and small enterprises in the urban and rural areas? So in this particular presentation, we will provide you with some insights on a program and an initiative run by the SONJO community to improve the livelihoods of micro and small enterprises during the COVID-19 pandemic. First, we learn how to go digital, and second, we link micro and small enterprises to COVID-19 treatment efforts. The first initiative, supporting MSE to pursue digital transformation. This is an initiative that was run in the early stages of the pandemic, particularly between March and June of 2020. So there are several examples of pandemic-induced behavioral changes. For example, before the COVID-19 pandemic, it's very easy for us to go to the retail shops, to go to the micro traders and buy goods and services and pay cash. However, during the COVID-19 pandemic, we have to adopt to the way that we do transaction. For example, now not only that we go to the internet and then browse goods and services, we use our smartphones, we use our iPads. We also pay using non-cash payments such as a debit card, credit card, as well as surface-based money. Now, there are some challenges for the micro and small enterprises to adopt to these needs of COVID-19 pandemic. So adoption of technology and going digital is indeed a solution. However, for first digital goers, they face low digital literacy. There is also limited access to training for them to know how to use and adopt digital for their business solution. They have also limited budget and knowledge to adopt the technology, and they have lack of knowledge regarding online marketing strategies. They also have low financial literacy, which is going to be challenging for them to adopt several different kinds of non-cash transactions and to also, for example, borrow money from financial institutions. And also they face lack of knowledge and then lack of opportunities to develop their product to the needs of the pandemic. So MSE must go through phases before they have to go digital. It's as simple as how to sign up for the email, and then using the email they can use different digital services. It's as easy as, for example, using WhatsApp and receiving orders from WhatsApp. It may seem simple for us who in everyday life uses technology to support our daily activities. However, for a lot of these micro and small enterprises, not only in Indonesia, but also in the context of developing countries, it's very difficult for them to adapt and then to use the technology for their everyday life. There are high learning costs, and then there's also out-of-pocket costs associated with the adoption of this technology. So this is something that the government of Indonesia as well as government from developing countries have to adapt, and also have to acknowledge that it's going to be difficult and challenging for this MSE to go digital. So we have to take baby steps. We have to guide them through every steps of the way to ensure that they can go digital. So first, we need to learn from the literature. Going digital is not just about going digital, but also to lay several economic and business foundation in order for them to thrive. Studies found that marketing, sales, accounting, and finance training interventions improve MSE profitability. Another set of studies show that a combination of training and mentoring of MSE also improve profitability as well as managerial skills. Subsidized consulting services by business mentors also improve their productivity. And lastly, social networks program through regular meetings to discuss financial management, supplier, clients, and recruitment improve sales and profits of micro and small enterprises. So these are some of the lessons learned that we get from the literature, and we try to adopt and implement it for the context of micro and small enterprises in our hometown, Yogyakarta, Indonesia. So community-based initiative by the SONJO community was designed to improve micro and small enterprises' sales, profits, and eventually their livelihood so that they can go back on track after the difficult period of the early pandemic. So we did online marketing tutorial. We also implemented and designed a progressive web app to showcase micro and small enterprises. The progressive web app is not designed to compete with the bigger and more established application out there. However, it's more on to train individuals to showcase their products and then receive digital orders and to send the products to their consumers in a seamless process. Third, we also conducted and implemented community-based marketing via WhatsApp group as well as Instagram. And lastly, we also conducted peer learning through social networks. So this is the implementation based on what the literature has suggested for us. First, we're gonna discuss just a little bit of the implementation as well as the program regarding online marketing tutorial. Again, we have to keep in mind that a lot of these micro and small enterprises didn't have the opportunity to do businesses online and to promote their products online. So in this series of messages via WhatsApp group, micro and small enterprises are given YouTube link to learn first how to create a simple business logo. Second, how to take product pictures in a manner that is going to be appealing and engaging for the consumers. Third, how to create a product poster. And this is going to be important since this is going to be the first thing that the consumers see when they see their products. And lastly, how to market online via webinar. We use simple tools such as YouTube as well as the Canvas application in order for them to learn these foundational skills in online marketing. We then take this micro and small enterprises product and showcase them in a progressive web app. It's a very light web app. It's only based on Google Sheets. And there is, of course, there's no charge in being in this platform. But using this platform, we can request people who are interested in purchasing the goods and services offered by these micro and small enterprises, and then they can order it just through the WhatsApp. It's very easy for them to showcase their products, the types of products, the prices, as well as the way that they can order their goods and services. So after we created the online marketing tutorials, and then after we created the progressive web app, we also conducted and implemented community-based marketing. We collaborated with the Department of Political Science at the Universitas Gadjah Mada to promote their goods and services via their Instagram account. It receives a lot of attentions. It received also a lot of feedbacks from the community regarding the products and services offered by these micro and small enterprises. And of course, it creates more awareness on the different types of local goods and services offered by these various micro and small enterprises. We also did peer learning through social networks. One of the study case that we can learn is innovative packaging is very, very important during the pandemic. A lot of people cannot go to other cities, to other towns to, for example, experience and to buy goods and services, particularly food and beverages. So we need to be innovative. We need to think about outside the box for them outside of their hometown to get the food that they usually buy when they go and travel. So in this particular case, we want the micro and small enterprises to learn how to vacuum pack their products so that they can export it to people living in different cities. However, it takes trials and errors to get the vacuum packing right. And it's very costly for them to actually do the trials and errors. We're very fortunate that several micro and small enterprises have done this trial and errors, and they're willing to share their experiences and some of the lessons learned to other micro and small enterprises so that they can adopt the same technology. And at the same time, given that there is this social learning, it's going to reduce the adoption costs significantly. So we did a series of YouTube webinar. This is one of the example of the YouTube webinar that we conducted. And in this particular webinar, they learned about doing vacuum packing, what's the most cost-effective way of doing vacuum packing. And a lot of the micro and small enterprises have now adopted this vacuum packing, so they can now sell their fried noodles, they can share their other dishes, not only to people living in the same town, but also people living in the other town, taking advantage of the newly established logistical route that allow people to freeze their products. So these are some of the opportunities that our initiative take advantage for the improvement of the livelihood of these micro and small enterprises. Lastly, we adopted this graduation approach. After some of these micro and small enterprises learn and upgrade through the SONJO community, they can now join established online platforms. In Indonesia, this could be Tokopedia, this could be Shopee, this could be, for example, Blibli. In United States and the European context, it could be Amazon. After learning and upgrading through the SONJO community, they can also improve their product line. For example, several of the micro and small enterprises, they have this catalog that are distributed during the festive seasons through the SONJO Hamperfest program. Also, there is a SONJO Expert Community Program where we push and we motivate these micro and small enterprises to expand to the other domestic as well as international markets. So that's the first intervention and programs by the SONJO community to improve the livelihoods of the micro and small enterprises that are adversely affected by the COVID-19 pandemic. And the second initiative is linking these micro and small enterprises to COVID-19 treatment efforts. So as you can all notice, there is a significant disruption in the market and the way that we do our transaction. Previously, it's easy for us to go into the retail shops. We can go directly to the farmers and to buy vegetables and fruits. We can go to the traders to purchase goods and services that we need. However, during the pandemic, it's going to be quite difficult for us to do so. So there is this significant disruption in the value chain as well as in the supply chain, such that a lot of the demands and a lot of the supplies are unmet. So the Sonjo community created this initiative where they initiated the Sanjo Shelter program. So the program provides isolation shelters in collaboration with villages, schools, universities, as well as corporations. Individuals with light symptoms, asymptomatic individuals, as well as patients waiting for their PCR results can stay in these village-based shelters. Now, these shelters can seem to be isolated. However, to fight the isolation, they provided the shelters with a lot of amenities. For example, Wi-Fi connection, internet connection, in some cases, it's TVs and stuff. More importantly, they also receive food vouchers worth 180,000, or it's about $40 in purchasing power parity terms, for a total of 10 days. So that's a lot of food vouchers that they can spend during their isolation period. Now, the funding from these food vouchers is obtained from various philanthropies that support the program. So through this initiative, we empower local micro, small enterprises to supply food to people who are in isolation in these shelters. So we channel funds from these philanthropies to local retailers as well as local farmers with the application called pasardesa.id. And from this pasardesa.id, there will be distribution by volunteers who's going to distribute healthy foods to these individuals in isolation living in these village-based shelters. So we distribute only healthy foods such as vegetables, fresh fruits, and we avoid, for example, instant noodles that will not be beneficial for people who are living in this rehabilitation for the COVID-19. So as a closing remarks, first, to improve the digitalization among micro and small enterprises, we must acknowledge and identify micro and small enterprises' stages of development. There are micro and small enterprises who have very little experience and opportunity to adopt to technology, but there are other micro and small enterprises who are very much literate with digital. So we have to have different interventions for different micro and small enterprises. The government must then tailor interventions or programs that best suits MSE's stages of development. And lastly, we can link local MSE and agribusiness to government-run COVID mitigation and treatment efforts to improve their access to the market. Thank you so much for the opportunity to present the Sonjo Community Initiative to improve the livelihood of the micro, small enterprises. We wish you health and safety during the difficult pandemic situation. Bye-bye.